Welcome everybody. My name is Matt Birdwell from FND Hope UK. I'm joined this afternoon by Bridget, the founder of FND Hope, and also with us this afternoon is Dr. Glenn Neilsen from St George's Hospital, who's going to talk to us about a new trial that he's responsible for called Physio for FMD. So with that, Glenn, I'd like you, if you wouldn't mind, just take a few minutes just to introduce yourself, your role at St George's, and then we can talk a little bit more about the trial.
Hi, everybody. Yes, I'm Glenn Neilsen. I'm a neurophysiotherapist, and I have a clinical interest in functional movement disorders, or functional neurological disorder, and also I'm involved in a lot of research on functional neurological disorder as well. I work at St George's Hospital and St George's University, and there we have specialist physiotherapy treatments which we're trying to roll out across the NHS, get funding for extra specialist treatments across the NHS and across the UK.
Okay, great. Now, obviously, earlier on this year, we in the FND community received the fantastic news that was a rather large pot of money being put aside for you to run this trial called Physio for FMD, and that money has been granted by the NIHR. So tell me a little bit about the process of what you had to go through in order to get that money, and why in this particular instance that body has decided to back this trial.
Yeah, it's a saga really. So it all started back, I think, around about 2012 when I started working quite specifically in this area, and I started some treatment services with Mark Edwards, who's a specialist neurologist, and we set up some programs, and we wanted to sort of do some research to say that physiotherapy was effective, and we started looking to get a research grant. And what we realized then is that if we're going to do it, we need to do a randomized controlled trial to prove that treatment is effective, and we need to do a randomized controlled trial to really convince the NHS to spend the money. And when we tried to get funding for a randomized controlled trial, they told us that first, you need to do a feasibility study to say that it's worthwhile doing a randomized controlled trial, to say that it's possible to do one. So that really became the focus of my research, I guess, we got the funding to do the feasibility study around 2014, and that finished in 2017. And in the feasibility study, we tested a specialist physiotherapy intervention compared to normal physiotherapy. And also we looked at whether or not people with functional motor disorder wanted to do physiotherapy, whether or not they found it acceptable to do the types of treatment and also to be enrolled in the trial. The other things that we had to look at is how to measure change. So you need to use special objective outcome measures, and we need to say that they're valid and reliable. That was the focus of the feasibility study. So the outcomes of that study came out in 2017. It was published, and I think FND Hope were very helpful in disseminating that information. And also it showed that physiotherapy seems to be helpful. So on the back of that, we then went back to the funding body, the NIHR, who are the main funding body for clinical research in the UK, and it's linked to the NHS. And so we said we'd like to do now a multi-center randomized controlled trial. So really that's the gold standard of research to prove that a treatment is effective. And so we have 10 specialists in FND as part of our collaborative group that put together this application. And it took about 2 years from the first time we decided all together to submit the application to the research, the funding was granted. And so there were 2 stages of applications, and we had to write an enormous grant with lots of information. And we also had to involve a specialist clinical trials unit. And within the specialist clinical trials unit, we have specialists, health economists, statisticians, special data analysis people, special clinical trials people, all to sort of support us in running and designing this trial. So it's been a long journey, but we've got the funding, and we're hoping to start our trial in September this year.
Okay. And there's a couple of questions that I wanted to pick up on, Jan. I'll go for the one that really sort of jumps to mind first of all, and pick up the second one in just a second. But the purpose of this research trial, I mean, it's very easy to get distracted by going, oh, it's research, this is going to help, but what's the real purpose behind this? Because certainly from what I've seen out in the public domain, one of the key aspects of actually getting the money for this is the economic benefit to the NHS. So the provision of services and obviously the cost of ongoing treatment for sufferers of FND. Is that one of the key principles behind this research in order to prove that this is going to be economically viable?
That's an enormous part, and I think because that's a big part of our study, that's one of the reasons why the funders were interested in funding it. But the main thing we want to test, so we have two main aims, and the first aim is to test that whether or not specialist physiotherapy can help improve the symptoms of functional neurological disorder, or the motor symptoms, the movement symptoms of functional neurological disorder. So that's the first aim, and then one of the secondary aims is to test whether or not it's cost effective. So whether spending the money of treatment, I guess, saves money in the long term. So that really we're comparing our outcomes with the cost, and we're also having a look at if spending the money up the front with treatment saves money in the longer term. So they're all part of the aims of treatment.
And obviously there's been other studies that have been done, not on this scale, but obviously proving the efficacy or the specialist physiotherapy and the results that can bring. Is there still a need through, and it sounds as though there is, through this particular research project to actually prove that over again, that how successful the specialist physio can be?
Despite we've got quite good evidence at the moment that physiotherapy can be helpful, but it's not quite enough to convince the funders and the commissioners of treatment to make changes and to make physiotherapy more available. So really the gold standard, the only thing that they will look at, best evidence, is a randomized controlled trial. And it can't just be anyone, it needs to be a particularly big one. So the way they do that is they do a specialist statistical calculation called a power calculation to look at exactly how many people you need in that trial in order for the results to be really robust. So they can't just be due to chance, or they can't just be due to bias, I suppose. So one of the ways that this trial will be different is that we're going to include overall 264 patients in the trial. So it'll certainly be the largest physiotherapy trial for functional disorder to date. And there are other things that are important as well. One of them is that it's a multi-center. So rather than it just be one place treating people, what we hope to prove is that if you have a good treatment, you can teach lots of different physios to treat it, and they can all have a similar outcome, rather than it just be one physio being able to do the treatment, if you like, or one center. So we're looking to see that it's that it can be generalized across different treatment places. And
scalable then, I guess, as well.
Yeah, exactly. So it all needs to be practical, feasible, it needs to be cost effective in order to roll it out. So really to have equitable and accessible treatment, and also that it can be replicated. So whatever happens here in the UK, the way when you do a trial this sort of to this level of detail, theoretically it should be able to be replicated more or less exactly in other countries and in other settings. And so that's what we hope as well.
That was kind of a question I wanted to bring up, is what is the global impact of this study? I think often our members will see that a lot's going on in the UK, and they feel like, well, what's going on in my country? Why are we not getting that level of care, or why isn't anyone looking? But really, it doesn't matter that you're in the UK, because there is a global impact in what you're doing, right?
Completely. I mean, so much, I've learned so much from the other specialist centres that I haven't necessarily met. So based on the way they've reported their research and their findings and understandings in the scientific literature. So there's some real centres of excellence in the United States, in Edinburgh, and lots of places actually do research on this area, and in this way it's shared. And the important thing is that the research is reported in a way that the treatment can be replicated. And so that's what we really hope to be able to do, is to sort of, so everybody can learn from our experiences. And that's one of the big requirements of the people who provide the money, is to make sure that we have everything in place to be able to do that, to tell everybody what we've learned. And that's where organisations like F&D Hope are really important. F&D Hope was one of the organisations that said, we think this is a good study, so we need to thank F&D Hope for supporting the study. So they sort of wrote to the funders to say that this is something that the community, the patient community, are interested in. And then organisations like F&D Hope are important for spreading the outcome measure, spreading the outcomes of the trial, disseminating the information, so it just doesn't happen or stay in the UK.
Okay. One thing I just wanted to clarify as well before we get too much further, but just a terminology question for anybody who's not familiar, but randomized controlled trial, what's the meaning behind that?
Yeah, it's a good question. So it's certainly not my area of expertise. I'm a physiotherapist, but I'm also a research physiotherapist, so it's a question I should be able to answer. When you're doing a study, you're testing two different things. So the old-fashioned way was to test a treatment against a placebo, and a lot of these trials were designed for drug trials. So you might have the active drug or the placebo drug, just a sugar pill, and then you get a group of people, and then you randomize them by toss of a coin. So by chance, they have the treatment, the drug, or the placebo treatment, and then somebody who doesn't know which treatment they've had then measures the effect. So that's what it means by randomized, and the control is the other intervention. It's not the greatest explanation of it. So specifically in terms of my trial, we're comparing two different treatments, standard treatment with a structured physiotherapy treatment. We're getting 264 patients, and then we're using, by random, those 264 patients will have one treatment or the other treatment. And then the people who are going to have a look to see what the outcome is, they're not going to know what treatment they've had. So in this case, the control is the standard treatment. Does that answer the question?
Yeah. No,
sorry, it's not a perfect answer. I wasn't that prepared.
No, it does, but that nicely segues into obviously when do we expect to see that the trial will start? I mean, I would imagine that organising something like this, as you said, with a population of 264 people, it's going to take some time to get through this. So you want to describe for the viewers just what the process of starting this trial and how long it's likely to last for?
Sure, of course. So like I said, the sort of application for this trial, I think we sort of submitted the first application in 2016, and it wasn't till the end of 2017, the beginning of 2016, wasn't to the end of 2017 that the funders said yes after all the different stages. And then since that time, we've been doing all the setup work and all the documentation and getting all of the trial infrastructure in place. And the funding for the trial officially started in May this year. So we've been very, very busy doing all the next bit of setting up. There's an enormous amount to do. And then the recruitment for the trial, so when we actually start inviting patients to participate in the trial, that starts in September. And we've got somewhere between 8 and 12 different sites or places around the UK that will be delivering the treatment. So we set them up one at a time, maybe one every other week in September. So we expect to have all of the sites set up and recruiting patients and treating patients in the trial by about November or December this year. And then we think that it's going to take 20 months to recruit 264 people to take part in the trial. And so once the last person is recruited, which will be 20 months from September, then we need to wait 1 year to see what their outcome is. So overall, the whole process is going to take about 4 years before we have everyone's outcomes that we can look at. And then a statistician looks at those figures. They don't know what treatment they've had. They've either had treatment A or B, and compares them and comes up with the answers in an objective way. So it's exciting that it started, but it's not for another 4 years that we're going to have some data about whether or not this is effective. And that's one of the real tricky things with research. It moves so slowly. Something that I've discovered recently.
Yes, but as you say, with all the hurdles that are placed in front of you, then it's just one of those journeys that has to be gone through.
Yeah.
At least we're starting, and this is the, I think, the key thing for people to hold on to. Whilst it does take a long time to get the answers, it's the difference that it makes when we do get the answers that's so important.
Yeah, and I think the fact that funders like the NIHR and other ones around in different countries are choosing to fund these studies is really raising the profile and helping other people see the need for the treatment, specialist treatment in these sorts of areas. So I think there's lots of positive things that are happening in the background while this is all going on.
Okay, and for people who are, part of our FND community who might be sat listening to this conversation thinking, oh, I'd love to be involved in such a trial, what's the message that you can give them regarding that?
Unfortunately, it's not the type of trial, due to the type of trial we've had to do, it's not the type of trial that you can sign up to. The way it needs to be done is it needs to be embedded sort of into current services. So the sites are, so the patients will be recruited from the sites when they go to their doctor. And we hope to get patients relatively shortly after they're given the diagnosis. As part of the trial, patients should be getting the diagnosis quite quickly as well. So really we're looking at a best case scenario. So yeah, unfortunately it's not the type of trial that really keen people can sign up to by I guess discovering it and searching it out, which is a shame in a lot of ways. But it's just sort of the I guess the restrictions put on us by the type of trial that we've had to do.
Though, Glenn, as you're talking about that, in some ways this is just about physio, but really, if that's the case, if we can look at it from a positive perspective, is really what you're also doing is showing that if patients can be diagnosed and immediately go into treatment, then that's also effective. So, it really might end up helping patients. There again, it's a long process, but it really might help patients in the long run begin to access that care a lot faster than getting the diagnosis and then being sent home for a year or two waiting for that treatment. So
yeah, I really hope so. I think that's really important, and it's a message that we want to get out. So and also, like you said, physiotherapy is one treatment that can be helpful, and it's not necessarily the right treatment for everybody. So hopefully with studies like this, it might raise the profile and encourage other types of treatments to start to develop an evidence base by getting research funding.
Will there be the opportunity through the course of the trial to share any interim findings, or is it a case of, due to the way it's controlled, we just have to wait to the end?
I think it's we need to wait to the end. That would be a question for my statistician and the trial manager. But I think what's really, really important in these trials is that they remained completely objective, and which is why they're blinded, so nobody can really tell who's doing what. And when you start to, if you start to peek at the results, you can influence the trial, and so it's no longer objective. And it's, so I think the answer is we need to wait for 4 years. But along the way, we might be able to sort of publish and disseminate little bits of information. For example, maybe the structure of the trial, the important elements of treatment, those sorts of things.
Okay. And what role do our other key players here in the UK in the F&D community have in this trial? People like Professor Edwards, Dr. John Stone, Dr. Alan Carson. Where is their interest in this, other than obviously from a pure professional basis? But
so they are. You've mentioned half really of my co-investigators in this trial. So. Mark Edwards, John Stone, Alan Carson, Laura Goldstein, I'm going to miss somebody, Marcus Roiber, who really are the clinical experts in the UK, are all involved in the trial. They helped design the trial. They helped sort of with the scientific rigor and help sort of input it into the treatment. So they're a big part of it, and they're actually a big reason why we were able to convince the funders to give us the money, because of their expertise and many years of experience and their eminence, really. So they're all involved, and that's, so we're very lucky to have that community. I'm very lucky to work with such an incredible bunch of researchers.
Okay. Glenn, it's been an absolute pleasure having you take us through the details of this. Is there anything that we may have not covered that you wanted to bring up in addition to what we've already gone through?
I don't think so. I feel like I've not given you very straightforward answers, a little bit cryptic, and I apologize for that. It's to do with the way trials are designed and keeping sort of them objective. But no, firstly, I want to say thank you for your interest, and thank you to F&D Hope for being so supportive in the trial. And F&D Hope's a big reason why we're able to convince the funders to give us the money. And we're going to really hope that we have a successful trial, and we're going to be sharing information with F&D Hope along the way as soon as we're able to. So stay tuned, I guess.
No, thank you. And Bridget, I know obviously in your role as our international head and founder, you talk with a lot of other professionals around the globe. What's been their view and thoughts on hearing the news about this trial?
Well, and I think that's why I wanted to touch on it with Glenn about the global impact, is that they're excited, and there has been a lack of randomized controlled trials, and they do take a long time, as Glenn pointed out. And so it's really significant that we're actually getting a randomized controlled trial for FND. So I think that impact is on a global scale and on a research scale is very, very important. And, another thing I kind of wanted to even just mention was it does take a long time, as Glenn mentioned, to do these projects. And there's oftentimes that as it's going through the process, we can't talk about it as an organization. So, we've been waiting for years. When Glenn finally heard he had funding, we were just as excited to hear that as he was, because we'd written a letter and to try to support his research several years back. And so I think that I'm hoping anyway that it's helpful for our members to understand that we are engaged in the research community. We are advocating on their behalf. We are giving them a voice. And sometimes we can't always talk about it until the end result, comes about. And so I think it's important that we also kind of pass that along too. And we really appreciate that Glenn and these other doctors have been so supportive of involving our members and how we can help contribute and let us be a part of that. So we really appreciate it.
Thanks, Bridget. Glenn, last word to you.
Well, Thank you very much for your interest. I don't think I have anything else to say. Stay tuned, and hopefully we'll be able to get some evidence to say that early treatment and good treatment is worthwhile and can make a big difference to a lot of people.
Okay. Thank you very much again, Gwen, for your time. Thank you, Bridget.